The patient is Michael Creed, 56-year-old male, living alone. He woke about 10 minutes ago after passing out on his way to the toilet. Patient claims he had an onset of dizziness and nausea before fainting. He woke with pain down the left arm. He's never experienced an event like this before. We also found a hematoma on the back of his head. On arrival, his pulse was 96 beats per minute. He had a blood pressure of 140/85, a respiration rate of 26 with no extra effort. His temperature was 36.4. Skin was cool, pale, clammy, and had a pain rating of 5 out of 10. Patient's last observations were that he had a pulse of 80, his blood pressure was 130/80, his respiration rate was 16, skin temperature was 36.4, he was warm, pink and dry, and he had a pain rating of 1 out of 10. Patient's O2 sats were at 93%, but that's increased to 98. His eyes are pale, blood glucose level 6.2, patient was GCS 14 on arrival. He was a bit confused, but now he's back to GCS 15. And there was some slight crackles in his breathing. He also had some short and shallow breaths with a normal rhythm and no extra effort. Patient has type 2 diabetes, hypertension, hyperlipidemia and a history of alcohol abuse, and has been a smoker for over 40 years. He's currently taking Diabex, Lipitor and Atacand. He has a family history of type 1 diabetes and ischemic heart disease, hypertension, hyperlipidemia. He's allergic to morphine, it gives him a rash. His last oral intake was at breakfast at about 8:30. He hasn't consumed any alcohol or drugs in the past 24 hours. I gave the patient oxygen therapy at 4 litres per minute via nasal prongs at about 1:38 and administered 25 micrograms of fentanyl via IV at 2:05 for the pain. I believe the patient is suffering a cardiac event. We have a 56-year-old male who lives independently, Michael Creed, who has had a fainting episode accompanied by dizziness and nausea and pain throughout the left arm. The patient has a history of type 2 diabetes, hypertension and hyperlipidemia. A family history of type 1 diabetes and ischemic heart disease as well. His heart rate is 80, blood pressure at 130/80, rest rate is 16 breaths per minute. Skin is normal. Patient now has a clear chest with left equaling right, air entering the bases of the lungs. His O2 sats are at 98%, blood glucose level at 6.2%. His GCS 15, eyes are pearl, and temperature is 36.4. We gave the patient oxygen therapy at 4 litres per minute via nasal prongs and administered fentanyl at 25 micrograms of fentanyl. The estimated time of arrival is in 10 minutes.